everyone, OT Life Hacker here. I am super excited and so happy to announce that I am going to be starting my fieldwork next week. Hopefully I am one of the late ones, if not the latest one in my cohort, because with all the stuff that is happening right now, as I'm sure many of you know and can relate, there's a lot of uncertainties. And for the healthcare field, finding student positions for getting your practice in the field in the healthcare setting, especially in the hospital, or even, I'm sure this is for physical therapy, nursing, for speech therapy, and for many other students, not even in the healthcare program. It could be in doing internships for social services or for engineering, what have you. I bet a lot of us are going through this challenge right now in finding placements if we are doing our internships, our practicums. To get experiences is gonna be pretty tough because of cancellations and of people not accepting students right now due to the uncertainties of everything, and also because there's not many places, not many options anymore or right now. And with health insurance, all the changes in policies, I'm just so grateful and crossing my fingers that it happens, that next week I will be in fieldwork. I will be able to share with you guys my experience in fieldwork. I am preparing for my fieldwork. For those of you who are not familiar with fieldwork, it is essentially in occupational therapy. We get our hands-on practice in the setting, whether it be hospital, with children, at school, in clinics, what have you, skilled nursing. It can be anywhere, and we get to work one-on-one with the patients, or what the facilities allows us to do, of course. And so I am going to be going to the acute care facility, and there I'll probably encounter people who will be needing more physical support in helping them to get out of bed and do their ADLs, which are activities of I'm out of breath, which are activities of daily living. In the hospital setting, you're going to have people who have just experienced injury at the very beginning of recovery, may have difficulties with the very basics, such as being able to brush their teeth, being able to brush their hair, wash their face, and wash their hands. And so I need to up my strength. I need strength, because one of the things in occupational therapy, and this can be a difference you'll find between OT and PT. People often think OT and PT do the same thing, and it kind of looks like that in the acute care and hospital setting. In acute care and in the hospital, you'll often see occupational therapists trying to, say for example, help a patient out of bed. So they're at the edge of the bed and you're helping them up and helping them to get into their wheelchair, or helping walk with them to the bathroom, whether it's observing them, being right next to them, holding on to them, showing them how to properly use the walker or whatever device that they're using at that time during their recovery. And so you'll see OT and PT doing that, but the difference is that the reason we are doing this in occupational therapy, getting someone out of bed, getting someone off the toilet, what have you, is because this is part of the steps for every activity that they do. So in order to go to the sink, to use the bathroom, to take a bath, in order to be independent, you need to be able to simply get out of bed. I mean, for many, we think That's something simple, but really it's a huge thing to be able to get yourself out of bed, especially after recovering, especially if you've just had a hip replacement and you're in a lot of pain, you can't move. Occupational therapy and same with PT, we will teach you how to properly and safely get out of bed without having any injuries, further injuries. And for occupational therapy, we are doing this because we are helping you to get to the edge of the bed to be able to do your dressing, putting on your clothes to get yourself ready for the day, or to get up out of bed and go to the bathroom, to use the toilet, to take a bath, to do anything that you need to do to get yourself ready for the day and do the activities that are important to you, meaningful, that you need to do, and that it's just a part of you.